everyone is here except John Poole, who is unexcused, or sorry, is excused. And let's see, we are, Oxa's here and JJ's here. Olivia and is not here. And Harsha, he called me, by the way, or emailed me and said he would be absent, so excused. I didn't hear anything from Olivia though, but so Olivia and Harsha are not present. Okay, let's see. Otherwise, everyone else is here except Supervisor Poole. All right, citizen comments. Are there any citizen comments this evening? Citizen comments. I don't see any. Okay, citizen comments are closed. Any other comments? I don't have any particular myself. Any comments from the committee or YIG students? Anything you want to bring up? Comments? No? Okay. All right. Well, moving on. First, we have the approval of the June 4th minutes. We have 2 months of minutes we need to approve. Hopefully, you've had a chance to look at the June 4th minutes. Any questions, corrections, additions, subtractions, anything in regard to the June 4th minutes? It was quite a bit, I know. We did a lot that night. Anything? If not,
Move to approve.
move to approve. Supervisor Brown,
Yep,
second,
you got it.
second by Supervisor Nez. All those in favor? Aye. Against? So it looks like it passes, Mark. You were looking at.
You're gonna ask youth and governance first or not?
What's that?
Yeah,
See
you
if
can
you're
go.
gonna ask youth and governance.
Oh, darn it. Youth and government. Aye, okay. Thanks for reminding me. Okay, let's see. Approval of the minutes now from the joint meeting we had on July 3rd. Joint meeting with finance. Has anyone had a chance to look at those notes over?
July 11th.
July 11th? Yeah. Any questions, comments, additions, subtractions?
Move the
on
minutes
those.
from.
Move to approve Supervisor Nordigian, a second by, who seconded?
Me.
Okay, Supervisor Kirby. Youth and Governance.
Aye.
Aye. Committee?
Aye.
Okay. Minutes are approved. Okay, first, or next, we have a resolution to approve the appointment of Supervisor Felix Garcia to serve on the Kenosha County Board of Health. And it looks like Supervisor Garcia is here. Would you mind taking the hot seat for the, in particular, because of the owl? We need questions or comments. Okay, are there any questions for Supervisor Garcia? Or do you have, I mean, I do, I just, real quickly, maybe just right off the top. Well, so what experiences, you mentioned in your application that you had a lot of applicable or relevant experiences. Can you just maybe talk about some specific examples of the experiences you've had that would prepare you for being on the County Board of Health?
Yeah, so I'll say some of the bigger experiences come from being a first responder, and most of my jobs I've done security, first responding. With the jail was one of the biggest ones. Dealing with the mental health crisis, I believe that the jail was facing our county. We're really working there, put into perspective how much more we could be doing, and how much not just for even the employees, but for the inmates. And that really impacted me a lot personally.
Which one of the issues in particular in jail? My problem.
Mental health was a huge one.
Yeah.
But for me personally, I dealt with a lot. And that's why I resigned from there, was just a lot of mental health issues with myself, and I couldn't work in the environment anymore. And yeah.
Okay. Any other or anybody questions for Supervisor Garcia in regard to this position? By the way, I noticed, and I don't think it's a major thing, but you didn't sign it and date it. the application?
I signed it on the PDF, so it probably didn't print.
Oh, okay. I just wanted to point that out, that it
Yeah.
wasn't signed and dated. Okay.
I figured that would be an issue because, yeah.
Yeah, I mean, as long as it's signed and dated, that's fine. Any other questions or comments? Okay, do we have a motion to approve?
So moved.
Okay, Supervisor Brown,
Second,
second by Chair Uhas. All, Youth and Governance, okay, committee?
I'm sorry.
I,
I thought something else came in. Yeah, it was brought to your attention that, the full packet didn't come in. She sent it later. So
Okay, so it's
that's,
fine.
I'm sorry, that's an also kind of.
Okay, very good. Okay. Thank you much.
Thank you guys.
All right. All right, tonight, we have from Department of Human Service presentation by Dustin Feeney, Division of Workforce Development. And Dustin, you have all the time in the world. We're not gonna be rushed for the first time in 3 months.
Well, yeah.
So, take your time and, you have the floor.
Sure. Well, good evening, everyone. Thank you for serving your community on the Kenosha County Board and Kenosha County Human Services and for learning about all the great programs that we have. I want to say, so I'm Dustin Feeney. I'm the Director of the Division of Workforce Development, which encompasses economic support, child support services, and employment and training programs, including Workforce Innovation and Opportunity Act. I'll give you a little bit of background of where I came from. I started with the county in 1998 at the House of Corrections, which doesn't exist anymore. It's the Kenosha County Detention Center. So in 2000, I went over to child support, Kenosha County Child Support Agency at that time, worked there as a paternity investigator, which I thought I'd be driving around, going to houses and things like that. It was in front of a computer and doing databases, so it was a little bit different. That position no longer exists either. It morphed into a support specialist position. I did that for 10 years. Then I jumped over to economic support and did benefit eligibility for 2 years. Then I went back to child support for 6 years as a supervisor, and then for 5 years as the manager of child support. And then I've been in this role as the director for a little over a year. And part of the reason I tell you that is to give you kind of my background. Is I have a wealth of knowledge about child support services. I have a good knowledge of economic support. WIOA, Doug Bartz is the workforce development executive director. He can't be here tonight. I do believe he's going to come at some point to give you guys an overview, but I'll touch on that briefly because of the 3 programs, that's the one that I'm probably not the strongest. I will say too, I've done these presentations before. I don't remember being recorded, so I'm just going to say hi to my mom if I do good enough. And if I don't, I won't let her know to watch it. So, all right, next slide. Okay. So I can start here. So some of this will be read from the slides. At one of these, I got questions on that, and some of them I'm going to go off kilter, and I'll give you guys some of my own information. So economic support determines eligibility and conducts quality control for Wisconsin's healthcare, nutrition, child care, and employment programs. So what programs are those? That's Medicaid, Badger Care Plus, SNAP, which is the federal term for food share, and in Wisconsin it's called Food Share. The Food Share Employment and Training Program, which is actually contracted by the state to Equius in our area, but we do the referrals to Equius for those. And then the Wisconsin Shares Child Care Subsidy, which is child care here. There are, balance of the state, there are 10 consortiums in Wisconsin. Then there's Milwaukee, which kind of gets its own set of rules because the state runs it, oversees it, and runs it, so they don't have to adhere to the same rules. So of the consortiums, we're the only 2-county consortium. The next smallest consortium by county has 4 counties. So that we get advantages because communication, you would think would be better, but also we don't have as many counties putting in, money into their programs, although we're mostly state and federally funded. So in our consortium is called Wisconsin's Kenosha Racine Partnership Consortium. So if anybody's old enough,
Wait a minute,
WKRP, there's not very many.
Make it different than that.
We probably have 2 people that work there that know what that even means, or 3. So there's.
Old TV show. It's an old TV.
Yeah,
WKRP.
it's really gonna be dating it. It really has dated itself.
Yeah, even if it's 40, it could be Cincinnati,
Yeah.
Okay.
Yeah. It was a very creative name when they came up with it in 2013. So there's 43 Kenosha County team members and 53 out of Racine. So our current caseload is about 52,500. It peaked at the at the peak of the public health emergency, we got up to about 61,000 cases. And before the public health emergency, it was about 46,000 cases. We have gone through the unwinding process, which ended June 30th. Now we're still getting some more work. That was a year long. The state did provide unwinding of the public health emergency. Probably the biggest lift since, maybe they moved AFDC to W2, Wisconsin Works. So it was a lot of work. A lot of our participants weren't used to having to do renewals, weren't used to having to verify things. And we've hopefully, both our staff that, over half of them didn't work for economic support before the public health emergency. Hopefully both the staff and all our clients have learned the process a little bit better back to the way that things used to be. We have about 2,000 customers that come into the offices, both in Kenosha and Bristol. So we have an office, the job center, or the Human Services Building, whatever you want to call it, is the main hub, and that's where most of the customers come. And then the Kenosha County Center has customers that are going there that maybe live out there, and it's not a burden for them to drive to the job center then. We also provide outreach services at Kenosha Human Development Services once a month. And then we also process applications from the Kenosha County Detention Center, usually for inmates that are going to be getting released soon, and then also for a professional services group, and that's to get services for those clients. There is a universal caseload that's shared between counties. So when I did it, I had my own caseload, but they shifted to where everybody works all the cases. And we might be working cases for Racine, and Racine might be working cases for Kenosha. Although for the most part, we process our own documents, but everybody answers the phone. So we have a call center model. The Department of Health Services monitors our call center. We have contractual obligations to do that, but we also have to do, every minute, watch our call center locally in real time. That's assigned to the counties back and forth every other month. So our call center by contract has to be open 35 hours a week. So ours is open 36 hours, 8 to 4 p.m. Monday through Thursday, and 8 to noon on Friday. So our opportunities for training are pretty much limited to Friday afternoon for that staff. They just in June, they received 14,767 calls. That number went up probably to 16 or 17,000 earlier this year. But the good part is we process our applications, our June applications, at over 99%. We consistently stay at 99% processing cases timely and our renewals. So the numbers for last month were 33, or June, now we're August ready. We're 3,300 new applications and almost 4,000 renewals. If I'd have given you April numbers, those were both over 5,000. So there's a lot of volume there. Okay, so next slide. So when I worked for child support for 10 years, I felt like, oh, I'm a rock star. This is easy. I'm going to go to economic support. I'm going to learn this right away. It was difficult because there's hundreds of pages of manuals. They're online. The food share handbook, the Badger handbook, the Medicaid handbook with all the different Medicaids that there are, caretaker supplement, which is another process. We used to do W2, childcare, and they don't have all the same rules. And it's not just that they don't follow the same income, it's the different income is counted for different programs and different expenses are counted for different programs. So it makes it very difficult. So Our economic support specialists require 10 weeks of classroom training. And I have in my PowerPoint here, 6 to 10 weeks of on-the-floor training before they may confirm a case on their own. Oftentimes it's more than that. So, 6 months before they can actually even be working cases without a quality control person reviewing things. Some people have taken as long as 10 or 11 months. So I'll jump into volume a little bit. So 13% of Kenosha County residents are eligible and enrolled in food share. Equates to about almost 22,000 people. So the income limit for food share is 200% of the federal property level. You have to be below that in order to be eligible. And for a family of 3, that's $25,820 this year. That changes each year, obviously. Wisconsin shares child care subsidy is for working parents who earn up to 200% of the federal poverty level. Same amount as food share, which is nice. That changed July 1st of 2024. Before that, it was 185%. That scale does go up throughout the year if they're working, but then at renewal and intake, it needs to be at those levels. So just need to get a little background on that. In Kenosha County, we have 104 Wisconsin Shares child care providers. serving 1,263 children. That's as of the end of June. So Badger Care and Medicaid, so they're kind of combined programs. Currently, 22.5% of Kenosha County residents are receiving Badger Care Medicaid. That was much more during the height of the public health emergency. At one point, at the height of the public health emergency, 1.7 million people were utilizing Badger Care, Medicaid, food share, caretaker supplement, or childcare, one of the programs. So just to give you the kind of volume.
1.7 million in Wisconsin.
In Wisconsin, yeah, not Kenosha.
Yeah, no.
That would be a problem.
I know.
Yeah, but that's, so, and that's
How the
reduced,
math figured that. Yeah.
but that's reduced, now, and I didn't look it up before this meeting, but it has reduced. But that was the amount of people that were taking those services. Yeah, a lot. So, all right. Next slide. So I will smoothly transition to child support services, hopefully here. So the child support program promotes stable, safe and healthy relationships between parents and children and collaborates with our community to put children first, strengthen families, and encourage responsible parenthood. Wisconsin County child support agencies provide a broad array of services that reduce childhood poverty rates, establish parental rights, ensure children have access to health care, and promote the involvement of both parents in the lives of their children. So there is like a base amount that the state provides, and there's federal match. That's how it's funded. But then there are federal performance measures. And so the Wisconsin is based in those federal performance measures, and then each county is based in those federal performance measures. So they are your paternity establishment rate, your court order establishment rate, your current support rate, and your arrears collection. So that's how they do this extra amount of funding that you get in child support. One good thing about Wisconsin is last federal fiscal year, we were ranked 4th in current support. So I tell you that one because that's the best ranking out of all those. I think we're like 35th in court order establishment rate. I have no idea. I think the other states are cheating, but I think bringing in current support is probably the most important measure, along with paternity establishment. So funding would be reduced if those rates decreased. Currently, we have over 19,000 total cases for child support in Kenosha County. 11,500 or almost 11 are 4D cases or full child support services. So those are cases that we would interview them, file a paternity action, or file an action to get support and health insurance started for them, where we would do genetic testing in those cases, where if we had a court order, we would do administrative and judicial enforcement in the cases, where we would offer things like employment and training services and parenting services. So I jumped ahead, but we have 7,700 and those are the 4D cases are the ones that are eligible for state and federal money. So the 7,700 non-4D cases are cases that we only provide financial services to. So say someone middle class got divorced, it went over to us. So we, you get a case 4D because they were on some kind of public assistance program or in substitute care, or they applied for our services. But say someone just came over because they divorced, they weren't low income, they would be a non-4D case unless they applied for our services. So the only things we do on those cases is we do like the fiscal management of it. So we keep track of what they've paid and what they owe. And then we also send income withholdings on the case and answer questions when they call. But those are paid for out of levy, but they do require the least amount of work, hopefully. So other programs that we provide in child support are the Children First program. So that's an employment and training program that is if you're court ordered into it as a purge condition, as an alternative to going to jail, you can participate in the Children First program that will, you do job searches, resume building, and they provide supports to try to get them employment so that they will pay their support and support the family, obviously. That is subsidized by the state. There's only a handful of counties, maybe I should probably know this, like 12 counties that actually participate in Children First. That's not exactly correct, but it's about that many. But the Elevate program is a program that in 2012, Kenosha and Brown County were the only two counties that were awarded a federal grant. The grant went to Wisconsin and it was contracted to Kenosha and Brown County to provide extra enhanced services of employment and training and, barrier getting people to overcome barriers in order so they could find employment. And that has to be a voluntary program. That morphed into Children First Sharp, then it was 5-county demonstration program, and now it's Elevate. They've added 3 counties, Marathon County, Racine County, one more for sure, Wood County. So now there's 5 counties that are under this, I say grant, but the state's getting the grant from the feds, and then they're continuing the program here. So that started in 2012. It's changed. It's 2024. We're getting the next iteration of it for the next 4 or 5 years. We don't have the contract yet. So that allows, and that's, federal money that we're able to provide those extra supports to people in our community to try to make it so they don't have arrears on their cases and that they can pay and that they can avoid alternatives. So, and I just, this year, this is for the first half of the year, 85 people have been in the program for Children First. We found 36 jobs. That's the rate of pay. And Elevate, 131 people have been so far for the first half of the year. We found 89 jobs, and that's the average rate of pay. So then jumping to what's collected in Kenosha County on that whole caseload, we collect about almost $3 million per year for families. So it's since I've been involved, it's been somewhere between 33 to 36 million per year. I say Kenosha families, but sometimes they don't always live here. So just a heads up. And on a bigger scale, Wisconsin collects $841 million, serving 341,000 children in the state. So, and the child support program is one of the most cost-effective government programs, collecting $5.63 for every $1 that's invested in the program. So, and then I have 2 websites for you here. One is the state site. I think you can get there by putting like Wisconsin Child Support, but that's actually their real site. And they have a lot of good pamphlets and information on there. But really, I would say the better site is our site, which is KenoshaCountyChildSupport.com. There's a lot of really good information on there. And I've attached, probably because me and the current manager helped set it up what we wanted on there. And it has the best 3-minute video to explain the child support system that's provided by Administration for Children and Families. I always just want to show that video because they get right across all the information in like 2 minutes and 57 seconds. But there is all kinds of great information on our website. All right, next slide. So currently, Wisconsin applied for the Safe Access for Victims Economic Security Demonstration Grant, known as the SAVES Grant. The Administration for Children and Families Office of Child Support Services invited eligible applicants to submit competitive grant applications to implement comprehensive domestic violence policies, procedures, and program services to increase the safety of domestic violence survivors currently receiving child support services and increase access to child support services for victims who need child support but are not currently receiving those services. The demonstration will run 5 years. So why did the Office of Child Support Services issue the grant opportunity? The existence of domestic violence in the child support caseload has been acknowledged for decades, but scant research has been conducted on the incidence of domestic violence between parties in the child support system. What data is available suggests that the underreporting of domestic violence in the child support system is significantly more prevalent than previously estimated. In a study conducted by the University of Texas, 37% of custodial parents with formal child support orders reported domestic violence by the time their child was 3 years old. That's a rate of approximately 4 times greater than the rate of the family violence indicator flags on the custodial parents in the federal case registry. So the federal case registry is the federal system that draws information from all the state systems. So what we're seeing is that it's only reported in 9% of cases in Wisconsin, when really the study shows it's 37%. Many survivors do not have a formal child support order, but would like one. Almost half the mothers who don't have a formal child support order and who are not receiving any informal support 3 years after their child was born report domestic violence perpetrated by the father of their child. The federal office reports that 90% of domestic violence survivors would pursue child support if they could do so safely. Nearly 1 in 10 unmarried mothers completing a voluntary paternity acknowledgement at the hospital report being injured by the father during pregnancy. So that's just a little background information. And then I'll give you hopefully better news.
Yeah.
So next slide. So in Wisconsin, they branded it the Wisconsin Network for Safety in Child Support, the WINS grant. So they awarded that grant to 3 counties. It's kind of familiar. They awarded that grant to Brown County in Kenosha, just like the employment grant they did 12 years ago, and then also St. Croix County. There's 13 states that were awarded the SAVES grant, which is the parent grant. And then also the Lakota Tribal Child Support Agency was awarded the grant. They're the only tribe that received that grant. Now, Wisconsin Child Support doesn't oversee Lakota, but sometimes they do participate in our calls. So our priorities are to increase expert-informed training for caseworkers, create a survivor-led domestic abuse survivor council to include the lived experience of people that in domestic violence that have to participate in the child support system. So that's happening at the state level. Mapping the child support process to identify pain points, and particularly the paternity establishment process. So we've done that already. Child support document review. So those are just some of the things that we've prioritized in the grant that the state did and that they've brought to the sites. So a little background. So we're finishing up our second year. It's been a slow process, much more difficult than we thought we'd ever delve into, to be quite honest. And then, so the grant, I think, started October 1st, 2022. We did not even get the contract from the state until a full year later. So we had no idea what we're going to receive from it. So that really delayed our planning. And they do have a program manager at the state. Unfortunately, in the last few months, that person retired. So there's been some transition, but if you move to the next slide, I still have some good things that we've done so far. So we created in conjunction the 3 counties in the state, a SOS flyer, which stands for Safely Obtaining Support, which we put out at our lobby at the job center, but also at the Kenosha County Center. We hope to, our intention is to put that on other community agencies throughout Kenosha County. I asked if I could edit this, and I was told no. But I said, well, what about putting stickers on it? So when I do it, I put a sticker on for our local DV Advocacy Center contact information and our Kenosha County Child Support Services information. So that's the way we're moving forward on that document. That lets them know, hey, there are some additional things we can do if there's domestic violence to do our best to provide child support services safely. We received expert-informed domestic violence training for our staff. We did have a meet and greet for Child Support and Women Children's Horizons. We developed a screening tool and scripts for staff to use. It's the intention to roll this out at our in-service training on August 23rd, although I guess it has to go through state review, but I'm going to release the draft anyways, because that's when we're doing the training. And because we already had a screening tool that we developed and we included that in our application. But this is just a better version. And then we created a really good document from the expert informed training. There's a what helps, what hurts when you're working with domestic violence survivors. Just so caseworkers know, what helps the situation and what hurts the situation. We created a WINS support specialist position through the grant. We revamped the good cause process and how to triage cases. So good cause. So when you apply for public assistance, most categories you have to cooperate with child support, but you can apply for good cause not to cooperate with the child support agency. If you feel like you or the child are threatened, if you have a temporary restraining order, things of that nature, anything that you can prove. So we revamped that process to be more sensitive. Also, just to provide information to them that these are the things we can do if you still want us to provide services. These are the protections that we can give you. And also we've developed like a process where we'll triage cases with the management team and the WINS team, but also we've done this with the other counties that are also in the grant with us. And also just staff working cases through a domestic violence lens. So many of the paternity workers or workers that work on the paternity cases, they're already surprising me at how much better they are at identifying domestic violence situations when they're working with their customers now. So, okay, here's the awkward transition. So a little information. I'm currently serving as a Wisconsin Child Support Enforcement President. And the mission of the Wisconsin Child Support Enforcement Association is to provide training and networking to help local child support agencies best serve and aid the children and families of Wisconsin. Last year, WCSA members conveyed a need for additional program funding to Wisconsin's legislators in the 2023-2025 state budget for both local child support agencies and modernization of the state IT system. Governor Evers, the Joint Finance Committee, senators, and representatives were instrumental in securing this request to better serve the families of Wisconsin. County Executive Samantha Kirkman, Representative Amanda Nedwesky, and Representative Tip McGuire supported Kenosha County Child Support Services and the Wisconsin Child Support Program. The Kenosha County Board sent a resolution in 2023 to the state supporting the additional $5 million to the state budget for the Wisconsin Child Support Program statewide, along with many other counties. So we did that as like a huge effort. Many counties did it. Our county board supported it, and the governor heard it, put it in his budget, although I'm jumping ahead, and so did legislators. So so this might be like a pivotal moment for me to meet the governor and be in his chambers. So I have to provide this picture at least for the first year since I've done it. So legislators and the governor added the 5 million GPR to the state budget with the federal match that amounted to nearly 15 million in additional funds to the counties. Last year, after our December WCSA board meeting, members gave 34 awards out to the governor and other legislators. That was our thank you for their support. Consistent investments in county child support agencies ensures that the Wisconsin Child Support Program will continue to be one of the best in the nation. Ultimately, that children will receive support payments that help put food on their tables, clothes on their back, and school supplies in their backpacks. It also means that fathers will have rights established with their children, and both parents will benefit from the employment and social services offered by Kenosha County agencies. So, all right, next slide. So, another job. This is our current Kids Information Data System, known as KIDS. So this is the system that we're currently working under. It's difficult when I onboard 23-year-old people, but I'll jump into what I have for Hearst here for you. So Wisconsin County Child Support professionals are working with the state and hired vendors for this project. Over 100 county child support professionals have volunteered to become part of new committees or work groups related to the Child Support Modernization Project. They have been working on the new project since 2018, and the system launch is expected in 2027. Long time, right? Now that was pre-planning for a couple of years. I think the actual planning that they did a pre-planning period, then a planning period that I think started in 21. Hopefully we don't get an outdated system by the time it's 27, because this came out in 98. And I'll tell you what, 98, it was already kind of outdated. It's a secure system though, but it is difficult to train new staff. DCF was awarded the money in the last state biennial budget, but can only receive money for the system in each state budget. Therefore, they will continue to seek funding in subsequent biennial state budgets. Our new system will be called Thrive. Maybe the next time I talk to you guys, I'll be able to bring pictures of it. Well, that'll be 2027, although they might have something out earlier than that. So some of the key system objectives for the Thrive system and having a new child support modernization system is to replace a 30-year-old system that lacks basic modern functionality, reduce extensive time commitment performing manual workarounds that we have to do, reduce staff training time with intuitive modernized user interface and workflows, mitigate the risks associated with limitations of an outdated platform, and ensure compliance with state and federal security requirements. So that's the next big push at the state level, is to continue to push the funding of child support modernization so that we can get a current system that better serve our customers, our families and children, and also better for employees, in this new age in order to be able to work on this system. All right, well, next slide. So last but not least is the WIOA program, Wisconsin Workforce Innovation Opportunity Act. It's administered by the Southeast Wisconsin Workforce Development Board. It's funded by the Federal Department of Labor, the state, the Wisconsin Department of Workforce Development, and competitively awarded grants. It works with adult, dislocated worker, and youth programs. It provides career training and education, as well as supportive and follow-up services for eligible individuals. American Job Centers provide free assistance to job seekers and businesses for career and employment. It connects qualified individuals to potential employers. And so our job centers that it covers are the Kenosha County Job Center, Racine County Workforce Solutions, and the Walworth County Job Center. Next slide. And this is my last slide. So there's 82 Kenosha County employees in the 3 programs. Our core values are dedicated to the success and self-sufficiency of children and families, unified unduplicated service delivery, excellent customer service, referrals to community resources with a goal of reducing the number of families facing poverty and unemployment. Thank you. Any questions?
Any questions from the committee? Yeah, Supervisor Nordine.
Thank you, Mr. Chair. The 200% poverty level, that, is that we decide that, or is that something that comes from the federal government? The state
Federal
decides that, federal government? So when we have an 11% or 20% increase in cost, do we get an increase in that percentage, or do they at least increase the rate of, I'm not that familiar about.
They didn't
about
increase
that.
eligibility. They did increase during the public health emergency. They did increase, everybody would, for a family of 1, 2, 3, or 4, they did make it so you receive the maximum allotment and didn't, because it's a sliding scale,
Yeah,
depending on how much your earnings are. They didn't look at the earnings during the public health emergency, but that ended February 2023. What they didn't do a lot of was that there wasn't a lot of verification required during the public health emergency.
Right.
But that's the only time ever.
right.
Before that, for as long as I can remember, and now over the last year.
Don't we have families falling back because of the expense?
Yeah, and
Everything from
it,
housing to.
sure, and that's why we need to know, community, resources that are in our area that we can refer our customers to.
Okay, so we have,
Such as your Shalom Center, Sharing Center,
Right.
all other programs that.
so we have a way of plugging that hole.
Well, not really, but
If there's a
what,
hole.
what we have though is when somebody is over income, we can refer them to those programs. Is it enough? It's not for me to decide.
Is there anything we can do other than what we're doing?
But, more community resources. Yeah. Investing in, those programs that are providing those services. So, but, the federal government isn't gonna necessarily change or talk to the legislators.
Mhm.
That would be another thing that could be done.
Thank you.
Yeah. You're welcome.
Yeah.
So my question is, when you do have somebody who is experiencing domestic violence and they come to you for help, what is the process there and what kind of resources are offered? Because I do know people who have experienced domestic violence,
Sure.
and they were able to get very little help unless they had some kind of a court order proving that. Not here. So I'm just talking in
Sure.
general. So like, are there certain requirements that people have to meet? Do we just believe them and help? Which is what I want to hear. Let's be clear.
That's a great question and statement. And what I'll tell you is when I look at the manual for Badger Care as it's referred and in the child support, CSPR, what does it stand for? Child Support Partner Resource page. Ironically, it requires proof, right? But as part of the WINS grant, we can do things differently.
Okay.
And over the last year, we have. So we're taking statements. We had a few horror stories here in Kenosha, that actually were right in that beginning stages of child support. And they were required to fill out the good cause form and sign a data, right? We waived that in certain instances. It depends on the severity and the expedience of what is needed. And we waived those situations and we're hoping that we're setting a template in our 3 counties in the project for the rest of the state. So the answer 3 years ago was technically not, but we're changing. Hopefully we're providing a template. We're providing documents that the whole state can use.
Yeah.
There has not been, not without obstacles in the process. But I'm hoping that our screening process, they say, don't send out paper screening. I'm like, well, a lot is there, but we adapted it into a script when we talk to people. And then why do we have to require that they come in and sign some form? They have mobility issues in getting to the office. So these are some things that we're exploring as part of the grant. And we're hoping that we can set some templates that the state adopts. I know they're already going to adopt the SOS flyer. I'm hoping that we had a screening tool here in Kenosha. Our big push then was a script. And I'm hoping that the, state provides that to the rest of the counties and they use that. But I can still tell you that when I talk to other counties, they're doing it the way you said. So.
Thank you.
Any other questions for Dustin? Anything else?
You have a dying question that you want to get out.
I do have a question.
Yeah, Supervisor Brown?
I just didn't understand your slide and it was number. Sorry, should have had my question before I got it, everybody. Page 4. I don't understand what 4D is.
Oh,
I don't
yeah.
understand, is it the 4 things up here?
What it is I'm talking lingo in front of you guys.
Yeah.
Shouldn't be doing that, but,
Yeah. I'm sure everybody else.
so the child
understood.
support program next year is the child support program national 50-year anniversary. So it was created as it is now in the Social Security 5, section 4D. So we call it 4D case, but on our customers thing, it's the top right corner, they have a 4D case number. So it's better for me to say full child support services or financial services only. But,
But when you talk about full, is it these 4 things? Paternity.
yeah,
establishment,
well,
whatever
it's
establishment.
a lot more than that.
Uh-huh.
So if it's a non-4D case, we don't get involved at all. Those are usually private divorces, to be quite honest with you. The county child support agency probably files 99.5% of the paternity cases in the county. So yes and no. But 4D, that's what we're funded to provide all the services for. And non-4D is what we receive no state or federal funding in that county, but we have to exist, for those people to make sure that money flows through the system properly, that when there's an argument in court, if they paid and they didn't pay and nobody's pulling out checkbooks and canceled checks, really there's a ledger that shows it all. And then we do the income withholdings for them. Some counties charge for income withholdings on non-4D cases, financial services only. We've elected not to do that. Racine does charge. Should have said that.
Thank you.
You want to, but yeah, that's a case of where I didn't take out the lingo. So I apologize.
Hard to avoid sometimes.
Mhm.
Right.
Anything else? Any other questions for Dustin? Thank you so much for your presentation.
You're welcome.
Very
Thank
informative.
you.
Appreciate it.
Thank you. So if anyone's interested too, I have these books. The state sends them out. One of my ideas when I came here before I did this was just to go over the guide to applying. I don't know if it's something you guys would want. It provides all the ways you can apply, where you go, all the different public assistance programs that are available in Wisconsin, verifications that you need, and then like a lot of times people say, yeah, well, I provided check stubs. Well, you provided them from 90 days ago. They have to be from the last 30 days and we need 30 days worth. So then they get denied and they don't know why. And then it provides, all the contact information that you can have. So I'll leave these out here. The state provides this to us because they want these out in our community. It's online too. I don't have the website. I think if you look on here, you can find this online just as well. But this is very good. And part of the reason I bring it to you guys is it's outdated. So I'm getting rid of the old ones. But what we determined is that the only thing that's outdated is the USDA non-discrimination statement. So that's the only thing that's been changed. So, but we're providing that to our customers and doing this to you guys.
We have another question, Supervisor Hardee.
Yeah, just a quick question. Where do you normally have those?
So these would be at the the Kenosha County Center and at the Kenosha County Job Center. Now, I know that,
Would they be more well received in other areas like the library?
yeah, well, that's a good question. I don't know if they're at the library. I'll have to check into that. I know that Sharon Palmerville from the Sharon Center often requests that. So I bring them out there.
Right.
I know that, I'm sure they're in other areas. It's all available online. But this is a nice book if you don't have access to the internet. Or
Well,
people aren't trans-
And again,
Yeah.
when you're gonna go look for something online, when you
Sure.
know what to look for. So
Yeah, yeah.
Something like this, I can do it.
It's right there, yeah.
But here,
Yeah.
I can look at it. Yeah, I would like to see those out in the public,
Yeah, no, I'll
more
definitely check.
public areas.
So, yeah, I can definitely do that. And we have them in both, English and Spanish.
Okay, thank you much. Appreciate it.
Thank you.
Any other comments or any? No, we good? Anyone want to move to adjourn?
Adjourn.
All right,
Second.
Supervisor.
Got it.
Okay. Supervisor Brown and Supervisor Ned.
All right.
All right. All those in favor?
Aye.
Not using governance?
Aye.
We're adjourned.